And hello, we're back again. The Secure Seniors. We are so happy to be here today, and we have some great news for you. So anyway, let me introduce my co-hosts first, and then we'll get started on some really wonderful information about Medicare. Our whole program today is going to be on Medicare, and this is a topic that us seniors need to know about because it's complicated and it's sometimes confusing, and we need the experts to help us. So let me introduce our co-hosts first, and I'll turn it over to Sherry.
Hi, Sherry Gardner, a.k.a. The Gardener, and I am ready to snip the myths of financial security. I am a licensed financial professional as well as a life agent, and I'd like to welcome you all here today.
Thank you, Sherry. And Miss Deidre, Miss Lady D.
Thank you, Lady Lou. My name is Deirdre LaGuns, known as Lady D, the Financial Genie. I say that because education is where the true magic begins. So I am a licensed financial professional, and I'm eager to educate you in any way that I can.
Thank you, Lady D. She's terrific. Both of them are. And here's the news. We have a new co-host. We have a gentleman in the house, finally, instead of all these cackling hens. We have Mr. Steve Baker. He is a Medicare specialist, I think is the word he uses. Medicare specialist. So, Steve, introduce yourself to the audience, please.
Well, I'm Steve Baker, and I live in the Houston area, and I'm quite knowledgeable about Medicare in two regards. One is that I'm on Medicare myself and have been for quite a few years, and that tells you something about my age. So I'm not 40, okay?
Oh.
But I've been around a while, so I'm on Medicare. My wife is on Medicare, and aside from that, I'm a professional in Medicare, and I help people make the proper choices when they reach a certain age. And I answer their questions and make them feel comfortable with a certain choice that they've made. And I don't represent just one company. I represent a numbers of companies, and I can use the tools to make sure that someone is comfortable with the choices they make once they reach the age of 65.
Wow. That's great.
Welcome.
We need this.
Yeah,
We need all of this. So stay tuned.
Yes.
You're going to hear some things that I'm probably going to hear things I don't know either. And I've been on Medicare quite a while, too. But anyway, we're going to have fun today. And I brought some new toys. You know me and my laughing dolls. They are so... Come on, girlfriend. I think they must be running out of batteries. But anyway, we're going to laugh, we're going to have fun, and then I'll bring out the other noisemakers here in a little while. Okay, honeys, that's enough. They're still laughing. Down, girl. Down, girl. Okay. Now, so let's introduce our topic. We're going to be talking about the Medicare plan, program, whatever you want to call it. As we all know, things that have multiple facets are confusing, and that's why we have Steve as our new co-host. He is such an expert on Medicare. He has done this for many years and has helped many hundreds and hundreds of people wade their way through all the maze that is there. And he does offer free consultations, as do the other two co-hosts, Deidre, Lady D, and Sherry. So just know that you can call us or email us or whatever and get those free consultations. Because if you don't know the answer to it, you got to find out. And there's other people that might need to know too. So refer them to our show also, because we're here every week. We have a new show. They are recorded, but we can still get to you and answer all your questions. So Steve, he has a whole pile of stuff here that he's ready to introduce to us. So I'm going to turn it over to you and allow you to proceed, and we'll have questions.
Okay, great. Thanks
Thank
very much.
Mm-hmm.
The first thing I'd like to do is take the word Medicare and say that the Medicare is unique to the United States, and I'll tell you why. Medicare goes back many, many years, and right after World War II, those of you who may remember World War II, and they're getting fewer and fewer, but right after World War II, things started changing in the country. And you may or may not know that Franklin Roosevelt died in April of 1945, and Harry Truman took office. And Harry Truman had studied health insurance or health issues for people for many years. And he decided that what we needed, Canada was moving into it and England was moving into it, that is universal health care for all. And if you've been around, if you watch the news, that's been in the news the last 3 or 4 years. So he decided to do that, and he took it to Congress, and they said, nope, no way. It's too socialist for us. And so he kind of put it on the shelf and actually didn't do anything with it for the rest of his term. In 1952, he left office in, I think it was 52, 1952, and Dwight Eisenhower took office. And Dwight Eisenhower was a Republican, and he didn't want to have anything to do with it. So it dropped on, and people had to purchase and just make do, especially when people started living older in older years. But the thing about it is people weren't living nearly as long as they are now. So when you were 65, and in those years, you were old. Way old.
Way old.
Grandma, it's time for you to die. Come on. so
Changed.
that's right. So people just had to make do, the best they could. So in 1960, President John Kennedy was elected, and you know the story. Tragically, in 1963, he was assassinated, and Lyndon Johnson took over. Lyndon Johnson had been in Congress for many years, and he knew how to deal with congressmen and legislatures and the both houses of Congress. So he decided that at least we were going to have something for the seniors. So in 1964, he was able to push through the Medicare Act.
I didn't know that.
Yeah,
know that.
Medicare Act. That was the first
Wow.
time.
64.
Yeah.
4 years old.
Right. Right. And guess who received the first Medicare card? Anybody know? Anybody have any idea?
I think I know, but
Was
you
it-
tell
was
us.
it-
Okay. Harry Truman
Yeah.
received the first
Oh,
Medicare
my.
card. And
He should.
Yeah. And who do you think received the second one?
His wife.
Bess.
Yeah, his wife.
That's
Exactly.
amazing.
Yeah. So Bess Truman received the second one. And in those days, older people were just concerned about the hospital. They hated the thought of having to go to the hospital.
Right.
Yeah.
And in some cases, their parents had died in the hospital, and they left people with
My mom.
a bill.
Wow.
$500 was a huge amount of sum to leave to
Yeah.
the survivors. So that's what they feared most. So in the original years, Medicare just covered the hospital. That was it.
Oh, I didn't know that either.
Wow.
And so they paid the doctors with chickens and whatever they had, whatever
We
they
should do that now.
Right. So,
That's
okay.
my chicken.
Okay, so I think I got interrupted there.
Sorry.
But at any rate, the thing about it is that people were really relieved to have at least something. And soon in those years, just like it is today, when you turn 65, you're eligible for Medicare. And in those days, there was just one kind of Medicare, and that was it. And as years have gone by, it's evolved into other things. Medicare now has like four basic parts. Part A now still covers the hospital costs. There's a few other things involved in that as well. There's B. Now, B is probably about 90% of Medicare. B covers doctor's visits, tests, MRIs, CAT scans, all of that stuff. When you go to the doctor, you're feeling like something's probably wrong, and what does the doctor say? Let's do some tests, right? So
Famous words.
famous words.
Yeah.
Let's do some testing here and see. So they take your blood and blah blah blah, on and on. X-rays, all that, MRIs, CAT scans. So all of that's paid for through Part B. And some of those can be quite expensive for those people who aren't covered with any kind of medical insurance, as you probably know.
Yes.
So that takes care of that, but it only pays 80%. So we'll talk about what happens to the remaining 20% in just a moment. But it's evolved into that. And in 2009, I was in the business, had been in the business quite a few years, and they introduced something called, President Bush did this, called Part D. That's the prescription part of Medicare. That was issued in 2009, and it was a mess to start with. As a matter of fact, I had a full head of hair whenever it came into being, but we finally got all the stuff worked out. And we got moving people in the right direction. There were the pharmacists who had to get figured out, the physicians themselves, and of course the clients, the people who were on Medicare, had to figure it out as well. But it finally got all ironed out, and now Part D is a big part of Medicare. So the prescription part is actually quite popular with seniors nowadays. So there's something to be said about the simplicity of it in one regard. In another way, it's quite complex. So especially if someone's on a lot of medications, they have to take some time to decide. For example, in Texas, there are 41 different companies that offer a Part D, and each of those have 2 or 3 different plans. So you're in the process of pulling your hair out again. So what I do is I sit down and put it all out, lay it all out on a computer, and help folks make the right choices for Part D.
Great.
Wow.
Good. That's wonderful.
So the only real difference in and now the other 20%, that can be done with a supplement. Now there's 2 sides to Medicare nowadays. There's on the left side you have traditional Medicare, like we've been talking about, with the 80-20. On the other side is Medicare Advantage. Now, Medicare Advantage is quite different. There's copays and deductibles in those, but mostly people, I'm going to say in the lower 30% of income would fit very easily into the Medicare Advantage plans.
Okay.
There are some disadvantages to those as well, but there's actually disadvantages to both sides.
Always.
But someone needs to sit down with a professional,
Yes.
such as myself, and who can explain what they are and how they work and how they operate, and I can set somebody's sense of ease in place for them so that they're satisfied with the direction of where they want to go.
Great.
So I
perfect.
do that on a regular basis
Yeah.
and help people. So that's what I do.
He stays busy at it too. 'Cause
That's great.
what
That
is it?
is.
11,000 new
A day.
A day.
baby boomers
yeah.
retire. 11,000
Wow.
a day.
Well, not so much retire as they turn 65.
Right.
A lot of
Oh, that's
people,
true.
A lot of people are working way past age 65.
Yes, they sure are.
But there are 11,000 every day turning 65 in the United States.
That's huge. So we got a big
Yeah.
audience out there, hopefully.
Right.
Yeah.
Exactly.
That's right.
And people have questions.
Yeah.
And so I'm just over the phone. I'm able to answer a lot,
Right.
a lot of the questions with people. And
Now
leave
repeat
me-
your phone number for everybody.
It's 832. That's the area code.
Area code.
832 754-3292. I had a senior
We're
moment.
senior. Yeah, that's
Yeah.
right.
It's 832-754-3292.
Yeah, you just don't call yourself.
No.
Yeah, that's right. I don't call myself.
Who remembers?
That's right.
So definitely put that in your Rolodex if you still have a Rolodex like I do. And call Steve. He's
Yeah.
available. Now, if he's on the phone or if he's driving, you'll get a message to leave a message. So please leave your message and he will call you back.
Right.
Wow.
Okay, what's the next topic, Steve? Or does anybody have a question?
I have
Oh,
a question.
go
I mean,
ahead.
I've heard Medicare, Medicaid. I mean, what's the difference between Medicaid and Medicare?
Okay. Medicare is, as I've explained, is a federal program that was put in place way back right after World War II, and it's a government program. Medicaid is a welfare program. So if someone makes under, I could be wrong about this, but I think it's pretty close to $14,000 a year. That if they pass that threshold, they're not eligible for Medicaid. But if they're under that, they can participate in the Medicaid program. And all of those are separate because it's actually not a federal program. The government does pass the funds down to all the states, and the states administer the Medicaid.
Okay.
So Medicaid in Arkansas and Medicaid in Maryland are quite different.
Yeah.
And in California, it's different. Texas, it's what it is in Texas.
So it's a state decision.
It's a state decision.
Okay.
And they set up the rules and regulations for it. So the government that's called block grants. They just give them a block grant and say, okay, you take care of it. So that's, and the Medicare is a total federal program, and it's the same all over.
Okay.
In all the states, exactly the same.
Gotcha.
Makes it easier, huh?
Makes it easier. Okay.
What I have noticed, and I think people have to understand, a lot of people think that Medicare is something that's optional. So when they get close to 65, they think, oh, I don't need to get it because I have insurance already. What do you have to say about that?
Well, most of the insurance companies say that, they know, oops, yeah, you're turning 65, you better do something. We're not offering insurance past 65. And unless someone is continuing to work, there's a lot of, that's where you start getting the complications.
Yeah.
If they're continuing to work, they could have an option to stay on their group plan, or some of the group plans just kick them off and say, go get Medicare. And
Yeah,
so there we go.
I knew I wondered about that because like my parents, they had Medicare, but they had Medicare Advantage. But my dad worked for the government, so they had GEHA also up to the day they actually passed away. So they had both
Right.
Oh, good.
at that time.
Right,
Wow.
right.
Yeah.
Now all of the federal programs, in the military, there's something that's called TRICARE for life. And once you retire, you must put in 20 years or something. Well, I think that's the threshold, 20 years. And once you've done that, then you have TRICARE for life. And the reason they call it TRICARE is because it covers you, covers your spouse, and your children. So there's like a triangle there.
Yeah.
So the federal program for military retirees is one thing, and then for federal employees, it's not called TRICARE, but it's called just federal benefits. So now, if you're in all of the government agencies, you can imagine, you've got city employees, you've got
State.
you skipped one. You got county.
County.
Oh,
You got
okay,
you got county employees, you've got state employees, and you've got federal
Federal,
employees.
yeah.
So that's millions of people across
Oh,
that,
yeah.
that are probably going to be taken care of.
Probably.
Probably.
And
Yeah.
We're hoping.
and there's something else. I had something happen to a family member.
Okay.
She turned 65 and she wasn't informed. Like, you're saying you got to get informed. And she had the Medicare A, B, because she'd never been sick.
Uh-huh.
Then she got sick and needed to take medication
Uh-huh.
and was told she had to go all the way back to where she first enrolled
Mm-hmm.
and pay up to that point. Is that true?
That's true.
Ooh.
Wow.
It's
Wow.
that's the way they set it up, because what happens if you just think about the psychology, and if someone says, okay, I'm not taking any medications, I'm probably not going to ever take any medications,
Good luck.
so I don't need this D stuff. I'm not going to do that.
Yeah.
I'm going to wait until I need it, then I'll go get it. And it's, that kind of thinking is like, I don't need car insurance. I'm going to wait till I have a wreck, then I'm going to go get car insurance.
Like life insurance.
Like life insurance.
Like life
I'm
insurance.
going to wait till I
I'm
die.
gonna get it when I die.
Too late.
It's too late. So what they do is that they penalize the people who did not take advantage of it, and they go back, and that's for life too.
Right.
Yeah,
Right.
that's right.
So
And then you just
So-
imagine how much that would cost to add it.
yeah,
You're better
Oh,
off paying
my.
cash for your medication.
They wouldn't know it's
Yeah.
expensive.
So the best thing to do is just get it all anyway.
get it all
Yeah.
anyway.
Yeah.
Get it, get it done and taken care
Right.
of. Even if you don't take medications,
Exactly.
Yes.
that's the way to go.
I promise you will one day.
Right.
You will one day. You'll
Right. Live
start.
long enough.
Yeah,
Exactly
that's right.
right.
That's
You live
right.
long enough, you'll start taking,
Wow.
and you go to a physician, and he
Right.
or she will say, "Oh, your blood pressure's a little high." They start writing it out.
Oh boy.
Go get on this or whatever it is. All kinds of cholesterol medication.
Right.
That's
Oh,
Right.
yeah.
Diabetes,
I know.
everything.
Oh.
Yeah.
it's called the statin medications. That's for
Oh,
for
yeah.
cholesterol levels, and I'm gonna say probably 75% of all seniors are on some kind of statin
Right.
drugs
Oh.
or blood pressure medications.
Yeah.
Oh.
So it's important to have all of that done, and and typically when you go on Medicare, you have a it's called a wellness program that you can go into
Yes.
free. You can go to any doctor and they can put you in a wellness program, and you get a baseline
Right.
of where you are and what you've been. And it's important then afterwards for seniors to go ahead and go to a physician, get established with a physician, and that way they can go every year and just have a checkup.
That's what I'm talking about today.
Because
Yeah.
the older you get, the thing my mother used to say, I'm just like a darned old used car, you know. I get one thing fixed, another thing breaks
Gotta
down.
fall
It's-
apart, yeah.
so that's that's
Wow.
important. That's
Yes.
definitely important to have your regular exams. And
Wow.
Great.
Yes, it
so
is.
my wife and I both are on Medicare, of course, but we've had some experience too. I've had a quadruple bypass.
Wow.
Wow.
My wife has had cancer, and I've had cancer.
Wow.
Wow.
So we had the privilege of both of us being on cancer at the same time.
Oh.
On cancer treatment at MD
Wow.
Anderson. So
Yeah.
we know everything about it. As a matter of fact,
Yes.
you know, I have here a bill. I'm not going to pick it up and show it to you, but it's a bill. You see that? Let's see. Hold on one second. If this is the one. Let me look at this other one here. This is one of our bills. What does that say? $7,701. Okay, that's just my wife's. She's a lymphoma survivor, and every year she must go in and have a complete workup, X-rays, blood work, the whole thing that they do to make sure that the cancer hasn't reoccurred. The bill for that one day she wasn't even in the hospital.
Wow.
Is $7,701.
Wow.
And that
But-
was a few years ago.
That was a few years ago.
So now
Right.
it'd probably be more than that.
More than likely.
Yeah.
So, but look at what this says. The patient balance is zero. Why is it zero? Because we had Medicare and a supplement. That's why
Nice.
it's zero.
Oh, wow.
Yeah.
Yes.
That's beautiful.
You see
Yes.
what I'm saying?
And that's
It's a huge
something good to
difference.
share with people, even when they're just about to get on Medicare. Then they see the value of it and
Right.
know how important it is.
Right.
That's
That's
why
right.
he has these
Wow.
little babies laminated.
That's right.
Yeah.
So I show it to them, and I actually give a seminar on it.
Nice.
And I put these up on the screen, and so my wife is there, and she testifies to how it's worked for her, and
Yeah,
I've
that's wonderful.
worked as well. So it took care of my cancer. I was on the way. We were on the freeway. I was on the way to take her to her first treatment for cancer, and my cell phone rang, and it was my doctor.
Wow.
So he said, your biopsy came back positive. You've got,
Oh.
So
Wow.
it's like,
Wow.
okay.
Yeah, that's
But you know what? I didn't look at it like that. I said, hey, this is going to be great. We can both go to the same doctors. We're going to MD Anderson. So for about 6 months or a year, cancer, MD Anderson was our hobby. So we go-
right.
she goes to
Yeah,
her area,
that's
I go to
right.
my area, and we
A shared
find-
experience.
shared
yeah.
experience, right?
But
And
you
it
know
was
the
over.
key is you were prepared.
Right.
That's the biggest thing. Most
Being
people
prepared,
aren't prepared,
yeah.
and you were prepared. You and your wife.
Yeah,
Yeah.
That means everything.
yeah, exactly. So
Now, how long have you two been married?
58 years.
Wow. You don't even hear that
Congratulations.
anymore.
Yeah. And we
to
was
hear
telling
that.
some people at our church that we've been married for 58 years, but we've been married happily for 55 years.
Yeah, the first 3 years
You
were rough.
I'm not going to say it's the first two, even. It's like it's spread throughout. You know.
Well, hey, tell the truth.
Oh gosh, well this has just been so very, very informative, Steve.
Yeah.
And I know all of us have gotten something out of it. I know I have, because
Yes.
I've never heard all of this talk. I've got to come to your thing. Tell them where it is. In case you're in the Houston area, he has this thing every month.
Yes, every month at the LaPorte Library, Harris County LaPorte Library.
Wonderful. And it's on an evening
Yes,
at
yes.
7 o'clock.
Yes, it's on a Monday evening. I think it's like the second Monday of every month. I
Great.
have it.
Nice.
So make a
it's,
note.
You know, yeah, so anybody can come. It's free, and we're not selling anything. We're just giving advice and helping people, you know, and
Learn.
answer questions. And I tell my audience all the time, just raise your hand if you have a question, because by the time I get to the end, you won't remember it. So
Yeah.
so
Yeah,
go
that's
ahead,
true.
go ahead and answer
Right.
it right in the
That
middle.
is so
Just
true.
interrupt me, fine.
Yeah.
And there are a lot of questions because
Good.
people definitely want to get set up in the right way.
Right.
Yeah, there's never a
And-
dumb question if you don't know the
That's
answer.
right.
Right.
Because there's
That's
probably
right.
6 other people in the audience that are too shy to say,
Yeah.
I want to know.
true.
And then you ask. So somebody else had to ask. Because
Right.
people get shy when they're in meetings. They don't want to be the one that has to ask the question.
Right.
Because they think they sound dumb. It's not dumb. It's just something you don't know. And if you don't know what you don't know, you got to find out.
right.
That's right.
So,
So I've got hundreds of clients, and these people call me up if they have any issues or questions and whatever. If they get a bill they don't understand or something like that, so I'm
that's
able
great.
to resolve it for them.
we're going to call him our fairy godmother.
Fairy godfather.
Godfather. Godfather. Excuse me,
Godfather.
Steve.
I'm going to underwent a sex change all of a sudden, right here. Hey.
That and
Oh, wow.
he was growing hair a while
Yeah,
ago.
it's growing hair.
My
Hair
bowl
on
was
my
falling
head.
apart.
All right.
Oh, this has been so wonderful, Steve. I know everybody out there has questions. So be thinking them. Write them down now, because you're going to call Steve. Tell him your phone number again.
832-754-3292.
This is the expert, the specialist, the Medicare specialist. So if you're approaching 65, now is the time. Don't wait. Do it before you get there.
Yes.
Does it automatically go into effect if you've already signed up when that day you turn 65? How does that work?
Well, if you're born anytime in a certain month, let's say December, whatever it is, say December 10th, your Medicare coverage starts on the first day
Of 65
of when you turn of your month
of your month.
of your birth month.
Oh, of the month.
Yeah, of the month.
Yes.
Right. No matter when in that month you turn 65, your Medicare starts on the first day of
didn't know
it.
that either.
If you happen to be born on the first day of a month, then it starts the previous month. So
Oh,
like-
they give you
like-
some good stuff
Yeah,
then.
like July 1st, it starts in June, and so on and so forth. So-
That's perfect. Oh my
but that's
gosh.
when your Medicare coverage, and you should have everything lined up and ready to go by the time.
Yeah, don't wait.
Yeah.
Waiting
So-
is the curse.
So
And
I can explain traditional Medicare, and I can also explain the Medicare Advantage programs.
He's very,
as well.
very expert at
Okay.
this. He's been around, he's done it, he's helped so many people. And that's really, I think, why people get in this profession. They want to help you. And if you don't call, how can he help you? So we've come to the end of this show, this first segment with our expert, Steve. We thank you, Steve, for being here.
Awesome.
He will be a regular feature on our show. Every month, we will have one show dedicated just to Medicare, like a little roundtable like we've done today. And then the other shows will be the normal, where we have the 3 different segments, and you get some fun stuff. Because we haven't had a whole lot of fun today, but we've had
thought it was
education.
fun.
I loved it.
I had fun.
I had fun.
You had fun.
Yeah, I had fun. You're old sourpuss.
I'm
That's
sour
what you
puss
were
today. Well, I want to laugh some more. Give me some more laughs. Oh, here's another laugh.
Okay, yeah. Look at that. I knew I'd grow some hair one day.
Well, we thank you for being here with us. This has been terrific. So tune in next time, but go find us on Facebook. Just Google Secure Seniors. We're on Spreaker, iTunes, and Stitcher, and hopefully some other of the podcast shows. So come and join us anytime. Share it with your friends. We love you. Bye.
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 Bye.